Hey everyone, today with us we have Dr. Gyanendra Kumar sir, who is the Professor of Pediatric and Preventive Dentistry at Maulana Azad Institute of Dental Sciences. He is also the founder of South Asian Association of Pediatric Dentistry and the first dentist to deliver a lecture in the United Nations recently. We welcome you to our program, Medula sir.
Thank you, Dr. Meghna, and good morning to each and everyone.
So my first question to you is, what made you choose pedodontics in your MDS?
Actually, in 1990s, nobody can choose the pediatric dentistry as a profession. In my batch, everyone is towards the any other clinical branches, but nobody is interested to do pediatric dentistry. So I take a challenge to do pediatric dentistry as I am very fond of children's. I do a lot of things in pediatric dentistry.
So dealing with children is quite hard, isn't it?
Of course, yes, Dr. Meghna, it's very hard to, deal with the children. Their psychology, their way of understanding is totally different. We have trained about this. We have trained 3 years in a PG curriculum how to deal with the children.
So you have delivered a lecture in the United Nations recently. What was your experience like?
Dr. Meghna, it's my privilege and I'm honored when the United Nations headquarters called me to tell me the experience about the South Asian Association of Pediatrics who has done a tremendous job in COVID era. Okay, so what we did in COVID era, the outreach area of the Bhutan, Bangladesh and Nepal, where no dentist has gone to treat some of the patients during the COVID. The United Nations knew about this and they explore us. Okay, they called me as a dentist. First time in history, they called me as a dentist and wanted to know the experience of South Asian Association of Pediatrics, what we did in the COVID era. I went there. It was an amazing experience. I delivered a lecture in front of every nation's representatives. Okay, they cleared me and finally I got a permanent consultative status in the United Nations.
So what inspired you to start this association?
Actually, what happened ki I have visited Japan once in 2016 around. Okay, I met many of the South Asian pediatric dentists over there. We didn't know about that pediatric dentistry. We even don't know about the dentistry in South Asian countries. Like in Nepal, we didn't know before that who is the pediatric dentist, what are the other qualifications in pediatric dentistry. In Bangladesh, in Sri Lanka, there is no such a branch of pediatric dentistry in Sri Lanka till now. Okay, and in Bangladesh, there were no subject in pediatric dentistry in UG curriculum. Okay, in Nepal there were pediatric dentists that time also, but there is no postgraduate studies in Nepal. Okay, so Nepali students used to come in India and study pediatric dentistry over here only. Then we 6 members of the South Asian Association of Pediatric Dentistry visited to these countries, sensitized the authorities of the concerned bodies. Okay, then they ready to include a pediatric dentistry as a subject in final year in Sri Lanka and started a PG in Bangladesh. So it's achievement for us. Now we all 6 country members are united together. We met every year, once in a year, and we'll exchange the academic platforms, ideas, and many things we are exchanging together. That's the reason I have started this sub-society.
That's really such a huge achievement, sir.
Yes, thank you.
So my next question is that, what according to you is the most important thing a clinician must keep in mind while treating a patient?
First of all, concentration is the key of success. If you are treating a patient, concentrate yourself regarding the treatment only. Okay, the child patient is very, very unpredictable. He or she can move anywhere. So you can read the psyche of the child patients. Okay, accordingly you will treat the patients. So we used to, nowadays digital dentistry is coming up. So we are keeping in this mind we will treat a patient wisely.
So learning about the psychology of the patient is very important.
That is more important for any pediatric dentist because you can't predict a child patient. Yes.
So what's your advice to students who want to become a periodontist?
Pediatrician is a very upcoming branch. It's a vast future. Okay, and child patients is very vulnerable. Okay, you have to, if you have a patience and you want to learn, so definitely you choose pediatric dentist over the other branches. Yeah, it's a very challenging branch. It's very difficult to handle the children. But once you can handle, you will learn the handling of the child. You will love it.
Yes, sir.
Yes.
So you worked as the president of IDA New Delhi branch. What were your roles like?
We are able to know the general dentist also and what other specialty is doing. So on that platform we should know each other ki what other specialty is doing. Otherwise it is very difficult if we are totally in pediatric dentistry, we never know ki what exactly other branches are doing. So on this platform we can know ki what others are doing. Yes.
So you're a trained professional in dental lasers. Do you think adding this course to undergraduate curriculum is beneficial to the student when they set up their clinical practice?
Definitely yes. Undergraduates should learn the lasers because the laser is a very upcoming or established treatment. Okay, many of our dentists, undergraduates don't want to do post graduation, want to do practice in remote areas. They should know the handling of the lasers and the indication, contraindication of the dental lasers. They should learn the dental laser.
In the future, do you think more colleges will add this to their curriculum?
Yes, of course, yes. Very soon they are adding a laser in our curriculum, in UG curriculum. Many of other like artificial machine learning and many of the subjects which is untouched by the undergraduate, they will be added soon.
So coming to my last question, what according to you makes a person successful, hard work or smart work?
Dr. Meghna, I must tell you that hard work and smart work, both are equally important for the successful dentist. It's not like that you are doing a smart work but not doing a hard work. It's not a key of success. For the key of success is both hard work and smart work.
Thank you so much, sir, for giving us your valuable interview. It's a huge pleasure for us to have you on this platform.
Thank you.
Medula.
Thank you.